COVID-19 pandemic dramatically increased global demand for medical oxygen. Medical oxygen is an essential and life-saving medicine for patients in respiratory distress, including patients with severe COVID-19 symptoms. In Vietnam, medical-grade liquid oxygen is created at more than 24 factories, but many health facilities do not have the necessary equipment to store liquid oxygen nor piping to transport it to patient bedsides. This gap is most pronounced at the local and provincial level. In 2021, the Bill and Melinda Gates Foundation funded the Ministry of Health with support from PATH and the Clinton Healthcare Access Initiative to assess oxygen needs across the country. The study found that only 64% of provincial health facilities and 6% of district health facilities had liquid oxygen systems. Without these systems, health facilities are often dependent on oxygen cylinders. Cylinders are limited in the amount of compressed oxygen gas they can hold, and they have to be changed frequently to support COVID-19 patients with severe respiratory illness. The United States Agency for International Development, or USAID, recognizes the critical importance of liquid oxygen to saving lives. That is why, in 2021, they directed $2 million to build liquid oxygen systems and install piping that will deliver high-quality medical oxygen to patients. The EpiC project is now using these funds to install 13 liquid oxygen systems throughout Vietnam. Liquid medical oxygen is created in factories designed to produce it at a large scale. Hospitals and district health authorities procure oxygen from distributors who transport the oxygen from factories to hospitals in specialized trucks. These trucks can keep the oxygen in a liquid state by holding it at less than -183 degrees Celsius. The liquid oxygen is then transferred from delivery trucks to cryogenic tanks at the facility, which keep it cold. When it is needed, the liquid oxygen moves through a vaporizer that warms it, thereby converting the liquid oxygen to gas. The pressurized gaseous oxygen then moves from the system throughout the hospital via copper piping. This piping leads to outlets placed in hospital wards at or between patient beds. Outlets can be connected to equipment like nasal cannula and ventilators that administer the oxygen to patients. Tan Bien District Health Center in Tay Ninh Province received one of the new liquid oxygen systems from USAID. This rural facility struggled to manage its COVID-19 caseload during peak outbreaks. Without an installed oxygen system, they relied on cylinders that had to be replenished frequently by suppliers located more than 3 hours away. USAID provided an 11 cubic meter tank, along with a vaporizer, regulator, and more than 1 kilometer of piping that connects the system to 50 bedside outlets in several wards. Tan Bien is just one of 13 sites that received this kind of support from USAID in 2022. Combined, these systems store 129 cubic meters of liquid oxygen and have the capacity to support thousands of patients a day. USAID plans to install an additional 10 systems in 2023.
The improvements to healthcare systems we make today are critical to preparing for tomorrow's health threats. The liquid oxygen systems USAID is installing across Vietnam close gaps in critical care capacity and save lives.
With 3 liquid oxygen systems and 1 mobile oxygen generating plant provided by USAID, Tay Ninh is better able to meet the medical oxygen demand of the province and treat patients in need immediately. Not just people with COVID, but also those with respiratory-related diseases in Tan Bien and surrounding areas. The Tan Bien District Health Center collaborates with the EpiC project and vendors to organize staff training and assign personnel with responsibility for liquid system operation. Tan Bien has incorporated a regular budget for the purchase of liquid oxygen, as well as the cost of operation, maintenance, and periodic evaluation to guarantee the system is working effectively and safely.
In Tan Bien, the facility plans to leverage its new liquid oxygen system to provide more advanced care for a variety of medical issues by creating a higher skilled facility in this rural area. This will reduce the burden on the main provincial hospital located about an hour away. This system and the others provided by USAID can improve patient care at these facilities for decades. USAID's support is preparing Vietnam's healthcare system to respond to current and future respiratory pandemics while improving access to medical oxygen for anyone suffering from respiratory illness.